You know the famous starfish story. This little kid on the beach was picking up the starfish that were washed ashore and was throwing it back into the water. And then an old man, somebody like me, walking past or walking near the kid, says to the kid, "Why are you throwing the starfish back into the ocean? There are so many being washed away." So he said, picked up one, threw it back and said, "Makes a difference to this one." So that's what we need to do in this world. Find a need, look for a need, and make a difference.
There are many starfish waiting to reach their potential, and we hope to show you how you can help change the course of their lives forever. Over 100,000 Ethiopian children are waiting for life-saving heart surgery. Whilst the standard of surgical care in Ethiopia is improving, the expertise for this highly specialised surgery are not yet available, and the facilities to care for these patients post-operatively are limited. The partnership between Jackie Gilmore, Dr. Debbie Shetty, Dr. Colin John and Narayana Hospital in Bangalore, India has given new hope for these children with congenital heart disease and their families.
My name's Jackie Gilmore and my story started well over 10 years ago. It started with one young boy who was involved in a program I was running in Ethiopia at the time. This child was failing to thrive, and as it turned out, he had congenital heart deformity and needed surgery to enable him to fulfill his life. At the time, I looked everywhere to assist this child, and it turned out it was going to be a very expensive exercise. At that time, Dr. Debbie Shetty offered to operate on 30 children from Ethiopia with heart-saving surgery. I was absolutely overwhelmed by this and started working on what role I could fulfill and how I could potentially bring these children to Bangalore.
For the past 10 years, Jackie and her team have taken children to Narayana Hospital's Cardiac Sciences Institute in India for life-saving surgery. The children commence their journey in Ethiopia, where they are carefully selected and worked up for surgery. One of the hardest parts of the journey is leaving Ethiopia. Yared Walde, a past recipient of this life-saving surgery himself and a critical member of Jackie's team, has the difficult job of teaching the children about what they can expect in India.
One of my reasons just to be involved in these children's life is just I want to help them because I've been in that situation. They created their future now. Before that, when you ask them what you want to be, the only thing they want to be is to be alive. But now these kids, when you ask them, they want to be engineers, doctors, and also, presidents they want to be. So giving this life, these kids, they can give back to their country. So I'm really, really happy for the chance they've got, and I'm sure in the future they can become something.
Dr. Colin John, one of the hospital's leading cardiac surgeons, explains how the children present to him and how the disease impacts their lives.
They're usually, very small, malnourished. Malnourished because the cardiac condition is so severe that they're not able to feed, they don't put on weight. There is a lack of oxygen as well in a lot of them, and depending on whether it is failure to thrive because of congestive cardiac failure or because of lack of oxygen in their blood, is what we need to separate the babies. I think most of the parents, when they bring the babies to us, looking to us to restore that baby back to normalcy and back to their homes, and so that they can raise the baby as a normal child. I mean, that would be the greatest joy to any parent.
Our goal is to change the lives of 100,000 children currently registered in Ethiopia with congenital heart disease. It costs $3,500 for these children to receive heart surgery, which will ultimately change their lives forever. We desperately need your help, and any financial contribution will go directly towards this project. Please contact us, jackie.gilmore@gmail.com.
Thank you.